Hi there, everyone, again. Thanks for joining us for this webinar. My name is Tashfeen Ekram. I'm the Chief Medical Officer at Luma Health and one of the co-founders. And the topic of our webinar today is Beyond the Four Walls, Orchestrating the Patient Journey with Care Pathway Messaging. So I wanted to start off our webinar with a quote from one of our early customers that helped us really understand what the core problem was we were trying to address. So she's the Director of Operations at Family Doctors of Green Valley, and the quote is, "We'd like to do it all. Get patients in faster, keep a full schedule, track down those who need follow-up care, and engage them once they leave. But we struggle to simply reach our patients." And I think this summarizes a key problem that we at Luma Health are trying to address and are addressing with a lot of our clients. And in particular, I want to go over some of the ways that our clients are addressing this with the topic of our webinar today, which is one of our products called Care Pathway Messaging. Here is a linear representation of what a patient goes through, and I think anyone who has spent some time in healthcare knows that the pathway from a patient being diagnosed with a certain disease to getting better is not usually linear and is not usually this simple. It's actually even more complex and has multiple parallel paths, but I've tried to simplify it a little bit, but which still shows the complexity of what it takes for a patient to get from point A to point B. And you can see here is that in this sample patient journey, the patient begins with a primary care visit and ends up with a primary care visit and has many different points within the middle that need to happen for the patient to get to the end. Now, as our healthcare system becomes more and more complicated, if you imagine from the patient's point of view, this can become very complex. Unfortunately, there's a high level of health illiteracy amongst a lot of American patients, which makes it very difficult for the patient to get from point A to point B and understand the importance of the different steps that the patient has to take from getting from point A to point B. And that is kind of the core of the problem, is that a lot of our patients are getting lost in their path from point A to point B. Our healthcare system is even more fragmented. There's even more data that's being generated, and as we move forward and there's more ways to track patients, the process from getting from point A to point B gets even more complex. And what is important to realize in this is that even though those discrete events that we showed in the prior slide documented when the patient was seen by a physician, and then there was a few things that happened in between, and then again seen by the physician, what's important to realize is that in order for the patient to be on their healing pathway, a lot of the healthcare that happens actually takes place outside of the doctor's office. So you can see here a stat that we've pulled is that 80% of a patient's health is determined by factors outside of the medical practice. And just kind of thinking about it practically, that just makes sense. The providers would often only have FaceTime with a patient for maybe 15 minutes, and they might see a patient 2 to 3 times in a given year, which means that the majority of healthcare that happens has to happen between it. But the real question becomes is that how can we as providers, as individuals who are trying to deliver healthcare, how can we be effective at making sure that those 15 minutes is not what determines how the patient's outcome is, but that what happens between the 15 minutes appointments is really what's driving the health outcome. And one of the most common reasons medical errors happen and low patient engagement and poor healthcare outcomes happen is the second thing listed here, which is that it's miscommunication. So what we're realizing here is that there's a big disconnect between what is happening in the patient's office and the outcomes we are desiring, and it kind of boils down to the fact that it's difficult to help the patient orchestrate or to guide them in their journey on their path from being diagnosed to getting better. Now, what's the good news in all this is that providers recognize that there's a big problem and there's a breakdown in communication, and so do patients. And ideally, we are both trying to figure out how we can find a solution that can better help us communicate with each other. So, what would be a better way to communicate with each other? So, at Luma Health, we've taken a purposeful intent at making sure our messaging platform utilizes a platform that is pervasive, that is highly engaging, and easy to use. And one of the fewest and most effective ways of doing this is using text messaging. Text messaging is the most effective way to increase meaningful communication between providers and patients beyond the traditional medical visit. Text messaging is the most commonly used app in the United States. You can see a graphic that we're showing here, which shows engagement rates. And so you can see here that the engagement rate and response rates actually are in the mid-50s, which is quite a lot higher than almost any other communication you can think of, whether it's email, whether it's phone, or more traditional forms like even mailing it. Mailing a reminder or some sort of a notification through the mail. And so you can see here, varying from the ages of 20 to 80, you're getting engagement rates in the mid-50s, which is excellent. What is really important about text messaging is that that's where a lot of our patients live right now. And so it's a very facile way to communicate with them, and it doesn't require any education on the patient's part. And some interesting statistics around text messaging is that 98% of the text messages are read, whereas comparing it to the open rate on emails is around 30%. And not only are 98% of the messages read, 90% of them are read within 3 seconds. So these statistics, I think, underlie the importance of using a platform that is highly pervasive and that is highly engaging. And this is why at Luma Health, we have taken a purposeful intent at using this flexible and yet scalable platform of text messaging, which is highly engaging and pervasive across different socioeconomic groups and different age groups. So now kind of returning back to what is a topic of our webinar today, and that's called care pathway messaging. To summarize it, I would say that care pathway messaging is what I would say is the Swiss Army knife of clinical messaging. So if you ever had a reason to be able to customize a message based on some sort of clinical event happening in the patient's life, and automating that kind of outreach to the patient, this is what care pathway messaging can do. So kind of nuts and bolts, and then we'll kind of later in the webinar get into specifically how that works. But on a very high level, what care pathway messaging allows you to do is you can send a customized message based on a trigger, a clinical trigger. So the kind of different clinical triggers or filters that we have, for example, is a procedure that the patient's undergoing, and this is based on CPT codes, a patient receiving a diagnosis. We support both ICD-9 and ICD-10 codes, a certain appointment type happening, or an appointment happening on a certain day. It can also be filtered by a provider and facility location. And what is really important about care pathway messaging is that not only can the timing of the message going out be triggered by one of those filters that we've listed on the left, but the actual content can also be customized. And the customization can come either, it can mention providers' names, it can mention the patient's name, it can add in context of, for example, you just underwent this diagnosis, or you were given this procedure, you were assigned this new medication, and it can have personalized information about when your last checkup was, when your next checkup is due, etc. And to kind of sum it up, what it really is, it's kind of analogous to doing, I don't always like to use this example, but I think it can drive home the point is when, imagine stepping outside of healthcare, but imagine when you're surfing the web and you are visiting a website and you're interested in buying shoes, and then you go visit that website, and then later you find out that you get an email that is very highly targeted at you. And it's kind of pushed at you at the right moment, and you get an email because that email marketing campaign knows, for example, that what gender you are, what zip code you live in. Based on that, they can estimate how much income you have, and mapping all these things, they can sort of figure out what is the appropriate message to send to you in an email at the right time to kind of give you that slight nudge to make sure you buy that shoe. And care pathway messaging is something similar, but for a higher purpose, which is actually driving patient outcomes. And so what care pathway messaging does is that it gives you an ability to have a context of where the patient is in their pathway, in their in their journey as a patient, and be able to send that right message right at the right time to kind of nudge the patient to make sure that they do what they're supposed to do to get the appropriate outcome. So to kind of give you a concrete example, and I'll go into this a little bit later, a patient is about to have a colonoscopy, and you want to make sure that the patient shows up appropriately prepped for that colonoscopy. So our system would be sitting on top of your scheduling system. Luma Health will be sitting on top of your scheduling system and be able to understand the context of the patient, what's going on. We would know that, for example, 10 days from now, the patient is about to have a colonoscopy. And so we need to make sure that at that time, the patient goes to the pharmacy and gets their colonoscopy prep, so that 10 days later, when the patient does actually show up for their colonoscopy, that the patient is prepped. And that's just one example of care pathway messaging. And again, the way I like to sometimes term it is it's the Swiss Army knife of clinical messaging. So the idea is that it empowers all the workflow that you have to be able to drive patients from point A to point B. And we'll get into more specific examples of it, but that's kind of a high-level overview of what care pathway messaging is. Now, going back to this graphic that we had earlier, where the patient starts off with a primary care visit and then has all these different steps they need to take, and then there's a 12-month follow-up primary care visit. Over here, I've added on top some of our different products other than care pathway messaging that can help orchestrate this journey. So you can see on the left, it starts off with an annual well visit reminder, reminding the patient, hey, look, it's time for you to come in for your annual visit. Here are some documents that you can fill out for us prior to your visit. The patient comes in. Then the next path is that the patient is referred to a specialist. We have a referral management product which can help engage the patient to make sure that they get educated about why it's important to go see that specialist, and then help facilitate that connection and making that appointment. After that appointment happens, our service can send out a patient survey which ensures that the patient got the appropriate care they needed, and to make sure that the patient was satisfied with the care they needed, and helps you identify any lackings or any shortcomings that you might have had in your service, whether that would be disgruntled front desk staff, parking issues, long wait times. And what this allows you to do is kind of keep a finger on the pulse of your practice to make sure that patients are satisfied and be able to identify problems that are easily addressable before it gets out into the public or before it gets out onto a website or somewhere else where it can damage your online reputation and affect other patients coming in. Because after all, the best way to recruit to your practice other patients is actually word of mouth and your current patients and making them evangelists for your own practice. Going further down, let's say the patient was seen by the specialist and now needs to come in for a procedure, and following the procedure, the patient needs to get in for a post-op procedure checkup. And perhaps this specialist has a long wait time or does not have any near-term availability in their schedule, so we have what we call the smart wait list. What this does is it can identify cancellations that are happening in real time and then backfill those appointments looking forward. So it can, for example, look forward and say, here are patients that are waiting 2 months out for a particular appointment type for a particular provider. And then once a cancellation happens today or tomorrow, you can automatically start reaching out to those patients that are waiting out a long time and see if an earlier appointment works for them. The idea is that there are same-day cancellations that are very difficult to fill, yet there are long wait lists or patients who are waiting a long time, and so we can try to see if we can work those patients in sooner. And the last thing you can see here that is overlaid on top of this patient journey to help orchestrate is called patient recall, which is our platform's ability to recognize, hey, there are a group of patients that haven't been in for a while. You've missed your annual visit. And then we can do targeted outreach to those patients to not only educate them about why they should come in, but also facilitate for them to be able to make that appointment, whether it's right through that text message that they receive on their phone or giving them a link that helps them see a broad variety of options of when they can get in and book that appointment right from their phone. So these are our products that help orchestrate the journey. But now what we realized when we were working with a lot of our early clinics is that these are particular products that we've released that help orchestrate the journey at particular points of the journey. So referral management, when a patient gets referred to help them get in. Following the appointment, you manage their patient satisfaction, etc. What we realized was that there was a broader need for being able to do more customized messaging around specific events that were going on in the patient. And that's exactly where care pathway messaging fits in. Again, these are messages that are triggered by clinical events that are happening in the patient that then can trigger a message that is customized to the context of the patient or what's going on in the patient. Now make sure that the patient, again, gets that nudge to get them to the next step. So for example, here, the first care pathway messaging that we have here on the left is care pathway messaging for lab results. So for example, the patient comes in and is complaining of excessive urination, and so you suspect that the patient might have developed diabetes. The patient goes and gets that lab result, and lo and behold, the patient is now diagnosed with diabetes. You could, if it made sense in your workflow and you would like to do this, you could, for example, have a care pathway message that's triggered based on an abnormal lab result or just even a lab result happening. And then the past message go out to the patient, your lab results are in, we need to talk, click here to schedule an appointment, or if it works within your workflow, you could even include the actual lab result and send that out to the patient with educational material. And the idea being, again, is that this would normally either have to involve a provider to make sure that the message goes out, or a provider picking up the phone to coordinate a visit. This can all be automated, and the engagement can happen in real time, and the patient can feel really connected. Another example of care pathway messaging is, and we talked a little bit about this earlier, is we call pre-procedural instructions. Again, and this is all customizable, so they're just different examples of it, and we're going to dig in deeper of various other types of examples of care pathway messaging. But a good example of it is pre-procedural. So, for example, going back to the colonoscopy example, for a patient coming in for colonoscopy, and there are several things that need to happen prior to the colonoscopy date that ensures that the patient is appropriately prepared for the colonoscopy. So, for example, and the timing is customizable. Let's just say 10 days prior, you'd like to make sure that the patient walks over to the pharmacy and gets his or her colonoscopy prep. You would like to make sure, for example, 3 days prior that the patient goes into starts a clear diet. You would like to ensure that 1 day before, 2 days before, the patient stops taking their warfarin or aspirin. And currently, what would happen is that either this would be a manual effort where the patient is given paper at their last visit to outline this thing, or there may be someone who's dedicated in your staff to call the patient, make sure that these things are happening. With care pathway messaging, you can set up the messaging cadence such that this is automatically happening. And even at times when those messages go out, you can ask the patient to ensure that they're indeed on track. So that way, when the patient does show up for the colonoscopy, they're prepared. Now, again, care pathway messaging is very configurable. So not only can it help with managing pre-procedural instructions, it can also help you after the procedure. So let's just say after the colonoscopy, the patient goes home. Typically, your procedure is to call them 1 day later and say, are you experiencing any abnormal bloating, abdominal pain, any bleeding from down below? Now, this would require someone on the staff to make sure that they send a message or make a call out to the patient, keep track of this, and then be able to coordinate the care that happens. Care pathway messaging can automate that outreach. So that way you can say 24 hours after the colonoscopy is completed, I would like to send this message to the subset of patients that get the colonoscopy. And the message could say something to the same effect of, how are you doing? Are you experiencing any excessive bloating, abdominal pain, or bleeding? And then you can ask the patient to give input. And then what that does is that the patient can respond in their comfort at the time that's most appropriate for them. And then you can have someone on your staff that takes these responses within our platform and be able to orient or be able to shuffle them in the right direction, whether it's engaging the provider or whether it's making another phone call just to make sure everything's going okay. But the idea is that you can configure care pathway messaging to send out these custom messages at the right time to make sure that the patient is on track. So here are just some examples of different types of messaging. Some of them are care pathway messaging messages, and the other ones are kind of generalized other products that we have. So here you have an example of a patient being offered an earlier appointment. So this will be the smart wait list. Again, the way that works is that it helps match patients that might be waiting out a long time for an appointment to same-day availability or near-term availability. So our system sits on top of your scheduling platform, whether that would be your EMR or practice management solution. Our deep integration allows us to detect cancellations or openings, and then we can look out in front and say, here are a subset of patients that are a good fit for this, and then start messaging them to see if they can work in. And again, what we've done is our whole platform is text message driven. And so you can see here the patient got a notification and asking them, hey, are you available for this new appointment? The patient can respond yes. And then what we will do is if the patient already has an appointment further out, we will reschedule that appointment to the new availability. So clearing up that further appointment further down the line and making sure that same-day cancellation that happened or 2-day cancellation that happened is now filled, making sure that the providers stay busy and that patients are seen in an expedited manner. Here's another example of showing how our platform is readily customizable, and that it speaks to patients in how they want to talk. So a lot of different other messaging platforms, they allow you to take responses, but they're very canned, saying, ensuring the patient only can respond yes, no, one, or two. What we've realized is that because we're texting a patient, oftentimes the patient doesn't realize that they're receiving a message from an automated message that's not being necessarily driven or typed by a human being. And so they'll respond with not just yes or no, but something like this. And so our system is intelligent enough that it's actually what we like to sometimes term it as a conversational platform, where it can understand the intent of the patient and be able to do what it needs to do with that. Here is a good example of care pathway messaging, where the patient would get an automated message saying, following colonoscopy, hey, how are you doing? I hope things are going okay. And as you can see here at the top, the patient responds with, hi there, I need some help, I'm having some bleeding. And then based on what type of workflow you want, is that we can handle some of those responses for you in an automated way, or those messages can go out as an alert to your staff, and then your staff can respond. So here the staff responded, say, I'm sorry to hear that, how long have you been doing? And then the patient responds, just started today. And then after triaging that patient, the clinic decided we need to bring you in, and you can see here the patient able to interact with the clinic or with the provider from the comfort of their phone, and then be able to get the actual outcome that needs to happen, in which case it is booking an appointment and scheduling a blood test. As our last example, and this goes back to the colonoscopy example. So the prior message we just saw was checking up on the patient to make sure that the patient is doing okay. So that would be a care pathway messaging that was triggered by a certain appointment type happening, which was colonoscopy, and so that message could have been triggered 24 hours later. This message could be triggered when a lab result comes in or your colonoscopy result comes in. And then you can customize the message to say what you need to say. And again, when the patient's response comes in, we can create logic around helping you handle those responses if you want an automated way. Or it could just be surfaced to your staff saying when a response comes in, the staff will handle it. And so here, the patient was notified that your result is in. The next step is we need to set up a wellness appointment, and then the patient responded that would like one, and then the provider or the front desk staff responds and gives you a link to be able to how to book the appointment. So again, really allowing the providers and the clinics to automate a message around what's going on in the patient's life or in their journey, in this example, after a colonoscopy, and helping them coordinate that care. So I think another way we can summarize this is care pathway messaging can help providers meet a wide range of goals and ultimately improve their patient's health. And the idea being that it's highly customizable for your workflows. And so what we would like to be able to do is be able to walk into a clinic, understand the different kind of messaging workflows they're interested in, and we empower them to do that and to do it in a scalable way, in a highly customized and scalable way that's patient-centric. So now I'm going to go through some different examples of use cases of how care pathway is being used by our customers and how it can be used by you. So the first example I have here is improved chronic disease management and medication adherence. Increasing medication adherence, text reminders can have a huge impact on medication adherence for patients experiencing asthma, cardiovascular disease, HIV, diabetes, and more. Looking through the literature, there's a study, there's several studies that focus on or that have looked at how text messaging can really drive different outcomes. And so one of the disease entities that a lot of the research has been done is around diabetes. And generally what this revolves around is how can we liberate this rich information that the patients are generating that is very valuable to us as providers. So one of them is for diabetic patients, they're generating these glucose measurements. It can be quite hard to convince a patient to be diligent about recording them. But what they found was sometimes a simple nudge is all that it takes. And so a study that was published, I think, in the early 2000s, they were sending out text messages to their patients saying, hey, look, before you come into your visit, remember to take some glucose measurements. And you can see here what a dramatic impact that had. Whereas the patients that received text messages reminding them to bring in their glucose measurements adhered to a 66% versus 12%. A similar use case that's being used by our current clients outside of the endocrinology world is We have allergy and ENT specialists who are seeing patients who have extreme allergies. And what often happens is that these patients will have epinephrine pens or other type of pens in case they run into an allergic episode at home, but they're often not tested or they're haven't been approved by their physician. And what they found was that the patients would say, hey, I had them, and then when time came to push them, they tried to use them, they realized it wasn't the right thing. And so prior to a visit, our care pathway messaging platform can be configured to say, hey, look, 4 days before every visit, for patients coming in with a history of allergy to XYZ, we would like them to bring in their epinephrine pen to make sure that it is working properly. And similarly, the idea is that you can trigger these messages prior to visit to make sure that the patient, when they're coming in for their visit, is appropriately prepared. One of our nephrology clinics uses this to make sure that they bring in their labs. So this nephrology clinic, the problem that they were having was that their patients were going to local labs. So the nephrology clinic had relationship with some of the local labs, but didn't have a relationship with all of them. And so sometimes what would happen is the patient would go to a lab that they're not able to access the results from, and then they would show up for their follow-up visit. And the next step for the nephrologist was completely dependent upon that lab result. And so what would happen was the patient would say, yeah, I had my lab result. Oh, you didn't get it. It was done at XYZ lab a few streets down. And the nephrologist would say, unfortunately, I can't access that system. And now suddenly 3 months have gone by. The patient has come back after 3 months of therapy. And the decision point was to see if the therapy was working or not. And the nephrologist can't make a decision because they don't have the lab result in front of them. And so what they did was they started configuring using care pathway messaging that 1 week before, what they did was 2 weeks before, they would remind the patient to go get the lab done. Then 1 week before, they would remind the patient, hey, just to make sure, why don't you go get a copy of that lab result so that you can bring it in physically into our clinic. And they found a dramatic increase in their ability to engage their patients and to be able to actually help them at their visit when otherwise sometimes the patients were showing up and they would not be able to do anything at their visit because the lab results weren't available. And similarly, going back to the example here of medication adherence, being able to text messages, saying text messages to patients about reminding them about their medications is also very powerful. And we've seen several use cases around this of reminding the patients, hey, look, you were recently prescribed such and such medication. Make sure you start taking it because the impact of the medication is obviously not going to be there if the patient's not adherent to their medication. Switching gears a little bit into promoting public health and preventative care interventions using text messaging. Patients know what is, in terms of preventative healthcare, patients are well aware of what is important in driving those habits. So, for example, patients know that you should be brushing your teeth regularly. Patients know that it's a healthy habit. Patients know that smoking is unhealthy, or physical activity is something that can drive long-term outcomes, both cardiovascularly and in terms of reducing the risk of obesity and several other type of advantages you have of keeping weight down. But what's interesting is that patients, even though they are readily aware of these things and it's not lost upon anyone, sometimes they need that gentle nudge to push them or remind them about these things. There are several studies that have looked at this, how driving these simple message reminders between episodes of care can really dramatically increase adherence to these things. So, like we mentioned before, a lot of healthcare has to happen between cares of visits. So patient might not be seen for 2 to 3 months, and even those visits that happen are 15 minutes long. But what happens in between those visits? I think this is where care pathway messaging can have a very strong impact. So there's several studies done in between the 2010 and 2014 that looked at, for example, gentle reminders sent to patients between their visits about, hey, look, remember to brush your teeth, and it showed dramatic impact not only in ages groups where you'd see like where text messaging is relatively prevalent in the 30s and 40s, but even in ages below that and above that, you saw a dramatic decrease in patients when they came back for their visit and reduced amount of plaque on their teeth. Similarly, with physical activity, there was several studies done between about 2013 and 2017 in obesity clinics where patients were randomized either to text messaging, gently reminding them about healthy habits of how to increase your physical activity, like rather than taking the elevator, why don't you take the stairs? Did you remember to go for a 20-minute walk today, etc. Small pieces of advice. And what's important about this research that they did was actually all one way too. They did not actually allow for intake of response, and they showed a dramatic impact in the intervention group that were just receiving these gentle reminders of helping them become physical active. That when they came back showed that they had overall reduction in their net weights. And two other examples on public health kind of care measurements. There's Text for Baby. This was a project that came out of UCSD, and what they wanted to do was they found that particularly in the lower socioeconomic patients, that female patients who were pregnant, they found that their risk of harmful pregnancy outcome or high-risk pregnancy was significantly higher than those who had easier access to care. And a lot of it actually came back to this health literacy concept. And so they sent out these messages educating the patient about, for example, did you know that alcohol can have harmful impact on your fetus? Did you know that smoking can have a harmful impact on your fetus? And also educating patients about gestational diabetes for patients who had that, and helping them, giving them or surfacing to them appropriate educational material that can help them manage their glucose levels to ensure that the fetus has a better outcome. And again, and what's interesting about this was that these messages were also one way, but it showed a dramatic impact in terms of driving out these health outcomes. And again, this can all be driven by care pathway messaging, where you could filter your messaging to say to go out to only patients who are, for example, such and such age group, who have a diagnosis of gestational diabetes, who are following their last appointment. 1 week after they're following the last appointment, I would like to send them this message. Then 2 weeks following that, I would like to send them this message. And you can create an entire cadence of messages that goes out every time, for example, a interaction happens that's filtered by patients who have gestational diabetes. The last example I have here is Text to Stop, which was another project that came out of UCSD on educating patients about smoking cessation. Smoking cessation obviously is one of the most difficult problems that physicians face, because it's obviously smoking is highly addictive. What they did in this program was they randomized patients to getting, similar to Text for Baby, getting one-off messages that were one way, educating them on how important it is and giving them general advice about smoking cessation. And they saw a dramatic increase. Whereas in the control group, and these are patients, these are patients who had expressed interest in trying to stop. And so in the control group, they saw approximately about 5% cessation rate, and they were able to double that with merely just sending a handful of text messages in the intervention group, which received educational material about why it's beneficial, and gentle nudges about how are you doing. Remember, if you're having cravings, you can look for alternative sources for nicotine, etc. And so again, a lot of this can be driven by care pathway messaging, and it's a very powerful way of driving health outcomes. And what's important about it is that a lot of this can be done in the back without having you to invest a lot of time in doing this, so you can drive health outcomes, drive patient engagement, patient satisfaction without investing a lot of time on your end. Switching gears here, and this talked a little bit about this, but managing pre and post acute care. So, for example, the colonoscopy example that we've used, there is a lot of moving parts that have to happen prior to the procedure and after the procedure. Excuse me. And a lot of that coordination requires human effort, and sometimes the ball gets dropped. Sometimes the patient is not reachable if they're trying to do this outreach via phone. And so we can automate a lot of this communication that happens prior to the appointment and or prior to the surgical intervention or after the surgical intervention. So 80% of serious medical errors involve miscommunication between caregivers during the transfer of patients. And what is important here is that if you can keep the patient engaged, they can be the advocates of their own care. And so when the transfer of care does happen, if the patient is engaged, has a high level of health literacy because of the patient messaging that you've delivered to them, they can make sure that even though there's a transfer of care, that there is continuity of care. And what's also interesting about this is that patients actually appreciate receiving these text messages. So for example, a group looked at patient satisfaction following discharge. You can see here 3.8 out of 4 of the patients responded saying positively that they like the fact that after their discharge they were receiving these text messages. And again, this can this can be completely driven by care pathway messaging to automate this outreach to the patients. Another great example of using care pathway messaging is to drive health literacy. So 1 out of 3 adults in the U.S. struggle with health literacy. Unfortunately, a significant percentage of the patients, when they're at their visit, and they're, for example, being diagnosed with diabetes or perhaps cancer, or they're being given a new medication. Sometimes this news is often too overwhelming for patients, such that a lot of what happens in the visit goes above their head, and then once they go home, they've had time to digest it, they have had time to research it, then the questions start coming up. And so what unfortunately happens is that a significant number of patients leave their visit not having a great idea of what actually happened at that visit. They may be able to take 1 or 2 important things away, but then it leaves them with more questions than they have answers. So care pathway messaging can tailor this outreach not only prior to the visit, but also after the visit. So you can, for example, know patients coming in for a certain type of visits, you can start surfacing to them appropriate educational material prior to the visit, so that when the patient is with you for that 15 minutes, the patient is appropriately prepared to ask the right questions and be able to really accept the news or diagnostic information or new diagnosis that you're giving them. And again, this helps to bridge that gap that sometimes happens between episodes of care, which may be only 15 minutes every 2 to 3 months. But what happens in between is that this automated outreach can give you a way to send messages to patients, say, for example, surfacing the appropriate educational material following the visit, but also asking a question. So, for example, you're seeing patients who are recently diagnosed with diabetes. 1 week after, you would like to send them a message saying, hey, look, it was a pleasure to see you. Here are some educational material we like to share with patients newly diagnosed with diabetes. Check this out. And then they could do it at the comfort of their home, and whatever time is appropriate for them. And then you can automate another message that comes right after that, asking them, do you have any follow-up questions to what we discussed? And thus, this can automate some of that outreach and engagement, while also keeping the patient engaged and identify issues that might actually happen between cares of visit, because oftentimes a lot of things can get surfaced or patients get lost, and so this can help make sure the patient stays on track. A really good example of this patient education is something that we've seen one of our clients do. This is a Houston thyroid and endocrine specialist, and what they found was that patients were being referred to them, and oftentimes the diagnosis was established. So, for example, a primary care doctor noticed that their patient had hyperparathyroidism, so they would refer them to Houston thyroid and endocrine specialist. The endocrinologist, what they found when these new patients were coming in, they would have a set spiel or talk that they would give to hyperthyroid patients. And that talk would usually be about 15 to 20 minutes, so they would maybe slot in 30 minutes for their new patient visit, and 15 to 20 minutes was more or less turned out to be a didactic or a lecture, so to say, that the physician or the endocrinologist was giving to the patient. And what they found was that when the patient would come for the follow-up, they would ask a lot of questions that were covered in their first visit, but what happened was a lot of the information that was being delivered by the endocrinologist was not being grasped by the patient. It was overwhelming. There were a lot of new terms. And so the patient was not getting the optimal value out of that interaction. So this endocrinologist, what he decided to do was he said, well, why don't I deliver some of the material that I try to explain to the patient prior to their visit? And so what he did was he used care pathway messaging to detect a new patient visit that was coming in for a particular diagnosis. And so a week before the patient came in for their new appointment visit, the patient would get a message saying, we are looking forward to seeing you in our clinic in 1 week. Here is a link about the diagnosis you got. And it was a link to a pre-recorded video of the endocrinologist's 15 to 20 minute spiel. And what the idea was that the patient would be able to sit in the comfort of their home at their own time, be able to watch this video. And what the appointment visit was then more focused on was follow-up questions to that video. And what he found was dramatically surprising. He found that not only when these new patients were coming in did they love the fact that they had gotten material to learn about their disease before they showed up, but they were actually had the questions that they were asking for their visits was much more meaningful. And it gave the patient the opportunity prior to the visit to really digest their new diagnosis. And he found that rather than dedicating 30 minutes in their new appointment visits, he was able to shorten his new appointment visits to just 15 minutes because the patients really only needed about that much time to ask their follow-up questions and then get the appropriate management care that they needed from their oncologist. And then what was even further interesting was that this physician, once he started doing this, he saw his online reviews and his feedback scores skyrocket. And so there's something, if you use our feedback product, we use a number called NPS, which is a net promoter score, which measures how happy patients are with your service. And so a perfect score, a negative score, and the score can be below 0, whereas the perfect score is 100. And he saw that his score, which was already pretty high in the 80s, after he started doing this pre-appointment messaging, it went up to 100. And really, it was because the patients wanted to have more information and they wanted to have a more meaningful experience with their physician. And prior to him doing this, the information was just too overwhelming. There was not enough time for them to really digest and ask their questions. And so what this really also importantly realizes that patients often ask for more time with physicians, but what this really shows is that really what patients are looking for is looking for answers and looking for better level of engagement. And this is what the endocrinologist was able to accomplish, that he was able to essentially scale his abilities by being able to share education material prior to the visit and be able to drive higher education levels, higher health literacy, better outcomes, and patient satisfaction. Again, all this was driven by care pathway messaging. Moving on to another interesting use case for care pathway messaging, and that's patient-reported outcomes. This is a big field. A lot of different specialists have found ways to make an easier platform for patients to be able to share some of their symptoms. What the underlying assumption was that patients with chronic diseases have varying level of symptom and response to therapy, and because a lot of the follow-up visits are short, a lot of these symptoms don't get discovered by the physician. And so making a way for the patients to be able to share some of this information back to the physician so that when they do come for their follow-up visit, or if they're not coming for a follow-up, but able to titrate some of the medication between visits, this will be an added benefit. So for example, there's been a lot of research that's been done on rheumatic patients with rheumatic disease. There's a lot of apps and things out there to help patients track a lot of this stuff, but what we have found working with a lot of clients and patients is that the patients aren't interested in downloading an app. They just want to simply be able to share some of their symptoms and be able to get what the provider would recommend on that. And so there's a study done earlier in I think 2013 or so that showed that there was a 98% response rate for patients who had rheumatic disease who got automated text messages between episodes of care to help them track their symptoms, and then this had a palpable impact on the physician adjusting the doses to help them drive that outcome. And in another similar important use case is patients with a history of cancer undergoing chemotherapy. What was found is that a significant number of the side effects that were as a result of chemotherapy were going unnoticed by the physician, and mainly that's because they would be again coming in for a 15-minute visit. The oncologist would have to decide, is the therapy working? When is the next imaging going to be done? Do we need to consult surgery? Do we need to consult radiation oncology? A lot of decisions need to be made, and so the patient's symptoms from the chemotherapy was a little bit on the back burner and often was overlooked. Now, patients with significant symptoms from chemotherapy can have permanent loss, can have unexpected visits to the ER, urgent care, or can even have a deathly outcome. a framework has been established that allows providers to be able to track symptoms between episodes of care. And what has shown is that this allows oncologists to identify harmful chemotherapeutic side effects before they become an issue and be able to titrate the dose. And so this can help them to titrate it down for patients who are not able to tolerate a dose, and then even be able to titrate it up for patients who are tolerating the dose well. And what this has shown is that this increases survival time, and it avoids unnecessary visits to the ER or being admitted to the hospital. Care pathway messaging can actually automate this outreach. So you can set a messaging cadence that says every time a patient comes in for a chemotherapy administration or infusion, one day after, send them this survey asking them how they're doing. Are you experiencing excessive nausea? Are you experiencing excessive vomiting, fever, numbness and tingling, or whatever the symptoms you want to be able to track? And then you can automate this outreach and then be able to collect data from the patients and then be able to filter through that data and be able to say, hey, look, here's a subset of patients that are doing perfectly fine, and let's continue them on their course. But here's a small subset of patients. This patient is experiencing worsening shortness of breath. We need to reach out to them right now before they get admitted into the hospital. And so I think you're going to start seeing patient-reported outcomes playing a stronger role in a lot of different specialties. And care pathway messaging can drive that workflow, drive that automated engagement to the patients, and be able to collect that data and help you sift through that data, figure out who those patients are at high risk for a poor outcome, and be able to adjust their pathway to make sure that they get the care they need. Getting onto the one of the last use cases for care pathway messaging, and this is on enhanced recovery after surgery. For those who are not familiar, this concept arose in Europe about in the early 2000s, and the idea was that, is there a way for us to coordinate the pre-surgical and post-surgical care to help drive outcomes? And the outcomes would be is to reduce hospital stay, is to reduce post-surgical complications like infection, and to be able to reduce post-operative pain, and to improve outcomes overall for the patient. Over the years, what they've been playing around with a lot of different protocols, what to do before the procedure, what to do after the procedure, and especially in the orthopedic world and the colorectal world, they've been able to really nail down what the protocol looks like in terms of what needs to be done for the patient, when the patient needs to be told to do this, when the patient needs to be told that to that prior and post procedurally. Again, similar to the colonoscopy example, a lot of this can be driven by care pathway messaging. So once you figured out, for example, this is what we like to be able to do prior to the patient getting a cystoscopy, that messaging can be done prior to the procedure and post and following the procedure to ensure that the patient stays on track, driving these outcomes of reduced hospital stay, reduced infection risk, making sure that post-operative pain is well controlled. And I'd like to sum up, this is a quote from one of our endocrinologists, and that says, Luma Health's care pathway messaging has been ideal for maintaining contact with our patients so we are all on the same page regarding their health and treatment when they come to our offices. And again, care pathway messaging can help drive those workflows and that engagement. It's highly customizable, and it can make sure that you stay connected to your patient between episodes of care when they're not in front or in your office. At Luma Health, we're looking to change the way patients interact with their providers and the way providers interact with their patients. And we have broad and bold goals. And so we're looking to impact 20 million Americans who need healthcare in the next 2 years. We'd love to help you out. If some of this sounds like you'd like to join the fun, it's been very humbling experience for us to be able to help physicians and providers and patients stay connected and be able to drive real health outcomes. And we'd love to hear what kind of problems you have and how we can drive that.